Hi, greetings to everyone. I am Dr. Balaji, Professor and Head Community Medicine Department, working in Tagore Medical College, and I am also a Tamil Nadu IAPSM Treasurer currently. I congratulate the Medical Education Unit of Switch India, which has planned to conduct online events in the lockdown time to enhance the knowledge of students. I really appreciate that. Switch India is a non-profit healthcare organization comprising of a group of 600 plus enthusiastic young medical students and doctors across various states. I'm extremely happy and honored to join you guys on this special day, World Health Day, April 7th. As you all know, this year theme focuses on universal healthcare and support nurses and midwives. I'm going to talk about universal health coverage. What is it? How can it be achieved? What are the dimensions to be focused? What will be the impact? So let's start the session. Universal health coverage. What does it mean? Universal health coverage means that all people have access to the health services they need, like prevention, promotion, treatment, rehabilitation, and palliative care without the risk of financial hardship and paying for them. Universal health coverage is not possible unless people can get health services they need without fear of financial hardship. What is needed to have a universal health coverage? What is needed? This requires an efficient health system which provides the entire population with access to good quality services, good health workers, medicines, and technologies. It also requires a financial system to protect people from financial hardship and impoverishment from healthcare costs. A strong, efficient, well-run health system that meets priority health needs through people-centered, integrated care by informing, encouraging people to stay healthy, detecting the healthy conditions early, having the capacity to treat the disease, having patients with rehabilitation, ensuring palliative care wherever needed. So what else is needed? Pertaining to financial aspects, affordability, a system for financing health services so people do not suffer financial hardship and using the health services. The next important thing is making it available. Availability of essential medicines and technologies to diagnose and treat the medical problems. A sufficient capacity of well-trained and motivated health workers to provide services to meet patients' needs based on the best available evidence. What services to be included under universal health coverage? The priority should be to ensure access to key interventions focusing on Millennium Development Goals like births attended by a trained health worker, family planning, vaccination, prevention and treatment of diseases like HIV, malaria and tuberculosis, while considering how to address the current growing problem on non-communicable diseases. What is a hurdle or what is a challenge? Do we have hurdles? Yes, we have a lot of hurdles. The dilemma for most countries, in particular lower income countries, is that they are not able to provide everyone with all the health services they need at an affordable price, even with the large increases in external donor assistance. So what's the solution for this? The goal is to provide an increasing number of health services over the time, while at the same time reducing out-of-pocket cost to patients based on people's needs, public opinion and costs. So how can it be financed? A key element of financing universal health coverage is sharing the resources to spread the financial risks of all ill health across the population. The system should collect large pools of prepaid funds that can be used to cover the healthcare costs of those in need regardless of their ability to pay. The countries that have made the most progress on providing universal health coverage have implemented mandatory contributions for people who can afford to pay through taxation or compulsory earmarked contributions through insurance. Yeah, there are three dimensions to consider when moving towards health universal coverage. The first one is extend to the uncovered population. That means you cover the population which they have not been covered previously. And next important thing is reduce the cost, sharing and fees and include other services gradually over a period of time. So these are the three dimensions to consider when moving towards universal coverage. Are countries succeeding in implementing universal health coverage? Yes. There are some examples like Nepal, Afghan and Thailand. Thailand has just celebrated 10 years of its universal coverage scheme, which has dramatically reduced impoverishment caused by out-of-pocket payments. What will be the impact of universal health coverage? Access and use of health services enables the people to be more productive and active contributors to their families and also to their communities. At the same time, financial risk protection prevents people from being pushed into poverty when they have to pay for health services out of their own pockets. So to conclude, universal health coverage is thus a critical component of sustainable development and poverty reduction and a key element of any effort to reduce social inequities. Universal coverage is the hallmark of a government's commitment to improve the well-being of all its citizens. Thank you so much.